Support comes from Hampton Roads Community Foundation, carrying out your charitable wishes forever. Whether it's helping shelter animals, feeding the homeless, enhancing the arts, or supporting students. Learn more at leaveabequest.org.
Hello, everyone. I'm Barbara Ham-Lee. Based on recommendations by the CDC and the FDA, out of an abundance of caution, all 50 states have put a pause on the Johnson & Johnson coronavirus vaccine after 6 women developed blood clots after taking the shot. One woman from Virginia has died. For many who are hesitant about getting the COVID vaccine shot, this latest news is one more reason for them not to roll up their sleeves. We know you have questions, and we have answers. We've assembled an outstanding panel of doctors ready to take your calls at 440-2665 or 1-800-940-2240. Give us a call with your coronavirus vaccine questions. Another View will be right back.
Discussing today's topics from an African-American perspective, this is Another View.
Hello, everyone, and welcome to Another View. I'm Barbara Ham-Lee. My thanks to producer Lisa Godley and audio engineer Todd Washburn for holding down the fort last week while I was on vacation. It was a wonderful vacation, and it's really, really good to be back in the seat and back with all of my listeners. So thank you so much, you two, for taking care of business. I appreciate it. So during this next hour, I need the phones to ring off the hook with your questions about the coronavirus vaccine. You can call us at 440-2665 or 1-800-940-2240. That's 440-2665 or 1-800-940-2240, and call in with your questions about the coronavirus vaccine. We have an outstanding panel of medical experts here to take your questions, dispel myths, and separate fact from fiction so you can make an informed decision about getting the COVID vaccine. So with that, let's meet our panel. Dr. Daniel Engel is a virologist and professor in the Department of Microbiology, Immunology, and Cancer Biology at the University of Virginia School of Medicine. How are you, Dr. Engel?
Good. Great to see you.
Good. It's good to see you too. We're watching each other on Zoom, so our audience will know what's going on. How can they see each other? They're on the radio. So we're watching each other on Zoom. It's very nice to see you. Dr. Rebecca Vargas-Jackson is with the Virginia Department of Emergency Management and COVID-19 Health Equity Group. Dr. Vargas-Jackson, how are you?
Hey, good afternoon now. It's after 12, and I'm doing pretty good. Thank you so much for inviting me.
Oh, we're so happy to have you, definitely. And our favorite cardiologist is here, Dr. Keith Newby, but in a different role as a provider of COVID vaccines and a member of the City of Norfolk's COVID Advisory Board. And in full disclosure, I'm also a member of that advisory board. How you doing, Keith?
I am doing well. And yourself?
I'm doing great. So we got to start by talking about J&J because that is the news of the week that everybody is tripping about in terms of the fact that they have put the vaccine on pause. Dan, I'm going to come to you. By the way, audience, all of the doctors have agreed that I may call them by their first name, so I'm not being disrespectful to their titles. This is what they have requested. So, Dan, as a virologist, what do you hear when you hear the CDC and the FDA say, "Whoa, slow down. We need to take a quick pause on this"?
Well, what I hear first and foremost is a serious concern for safety. And also, I hear a lot of transparency about this whole situation. There have been 6 cases that could possibly be linked to the vaccine. And these cases it's really a very unusual set of circumstances. It's blood clots that most people have heard about, but it's also accompanied by low platelet counts. And so this combination of blood clots plus low platelet counts is very unusual, and it alerted the authorities to possibly an association with the vaccine. And so there are these 6 cases that are being investigated. There have been 6.8 million doses of the vaccine. And so if it is true, it's a very rare thing. But because safety is such a concern, this pause has been instituted and is appropriate until we understand what's happening.
Keith, when we were in our advisory meeting yesterday, though, you brought up the fact that in terms of those who are vaccine hesitant, as I said in the intro, this is yet another reason for them not to roll up their sleeves. Are you concerned, particularly as it comes to the African-American community?
Very much so. And I mentioned yesterday on our other call, that is a big concern I've had, is getting people to want to do it. And I guarantee you now, I spend probably out of my office visits, at least 15 to 20% of the time I spend in rooms is convincing people that they should get this vaccine. I understand the caution. I'm just not sure I'm convinced that the rollout of how they sensationalize this in the media is helping anything. I think maybe if they had quietly just held it and confirm everything and then come out with a statement, would have been better to me than to do this, because I can guarantee that the people in my practice who I have, when we get in there and start talking J&J, they're like, I don't want it now, and it's because of this comment. Now, granted, you're talking out of 7 million dosages, 6 events, which are very, very small. So they may or may not be related. These are all women between a certain age, and I think the highest age
18 to 49.
Yeah. So, it's a rare event. And I just think the rollout of that comment is where my biggest concern was. Not that they paused it, but just how they did it. Because now it doesn't matter for a lot of people. They can come back tomorrow and say, everything's great. They're going to say, I still don't want it because, number one, I don't trust you guys that you're giving us accurate information. This is in my opinion, I think this is going to cause a problem for getting people to want to take it now, at least the J&J for sure.
Rebecca, I know that you deal a lot with the cultural side of medicine in terms of trust of the medical system and so forth. How has this pause, what's the reaction that you've seen, and how do we continue to encourage people to still go get the shot?
So it's a different probably reaction among professionals and the community, because I think for all the professionals that they are involved, either with the research or working directly with the community, and the pause probably means like, okay, let's see what happened before continuing. It's better to don't harm people, and let's try to have the facts, the scientific facts. I think for the community, it has created some panic in some sectors of the population, at least people that I kind of interact in community-based organizations, that they are serving new immigrant communities. We're talking about Hispanic, Latinos sometimes, and new African immigrants. That has been something that it was a concern about the vaccine. There was no understanding about the vaccine. There have been so many gaps in the system, questions about like, do I need to be a U.S. citizen to have the vaccine? And we have been making efforts so people could understand that this is for everybody. Mm-hmm. And I think now it's really hurting all of our efforts, because as new immigrant groups, sometimes there is not to label that these particular vaccines, but what we hear now is like the vaccine.
So they're grouping it all together for all 3 of the vaccines, as opposed to just talking about the J&J.
Exactly. And in other groups, I have been listening that the conversation was related to the fact that maybe there is a batch that has been contaminated and they send it to Virginians. So let's go to other states if you want the vaccine. So you know how the rumors go. And it's going to take a lot of effort now for us to turn it back, at least to whatever we were before. And there is no question about that. There is concern in the community. We need to understand that there is a large portion of our communities, Black and brown communities, that they always have had low health literacy skills. So navigating the system was always a problem and issues that they encounter gaps and sometimes mistrust to the government. And now with this issue, it's going to take a lot of effort for us to try to convince people perhaps to use the other two vaccines and, go back to whatever we were trying to be at the beginning of the conversation.
So, Keith, dispel the myth then that I know you and I have heard in the community that the Johnson & Johnson vaccine in particular was targeted to Black and brown communities as more of an experiment, once again, to use us in that way.
Well, the thing I'm trying to make sure that I emphasize to everyone is, and we've done Johnson & Johnson here in the office, and I guarantee you it's been equal amongst white and Black communities. This is not singular, and the people bring up Tuskegee all the time to me. And I'm like, if you're going to bring Tuskegee up, make sure you understand what happened there. And that's where we run into problems, because people don't really understand what happened in Tuskegee to that. There's no real similarities here. This is a vaccine that's open to everyone. So the J&J, the reason that, and I want to emphasize this, the reason why it was targeted was not so much behind any experimentation, but the concern was there were certain communities where trying to get people for a second shot may be problematic. So if they could give one shot and be done, that was the thought, that that's going to protect everyone, as opposed to maybe they'll get like one Moderna but couldn't come back for the second dose, and they're only getting half the protection. So it really wasn't designed as some experiment on Black and brown communities, but was more to make sure that the access is to everyone for every vaccine. But it was just those individuals who the concern was getting them back for a second dose. The thought was if we could get a one and done scenario, that's going to help protect that individual more than if they only got half the dose they were supposed to get.
440-2665 or 1-800-940-2240 are the numbers to call to join our conversation. We want to hear from you, whatever questions that you have, no matter whether you think it's a silly question or not. We want to hear from you so that we can help you to understand what's going on with the vaccine, and hopefully if you have not gotten your shot, that you will consider getting your shot so that we can get through this pandemic. 440-2665 or 1-800-940-2240. Dan, help me to understand something, because I hear this a lot in the community too. When you take the shot and when you are fully vaccinated, does that mean that you can no longer get COVID?
To a level of about 95% is what it means. Now, let's consider that for a second, because 95% is a great vaccine. For instance, the flu vaccine that many of us get once a year is not nearly 95% effective. So this vaccine is a super vaccine, but it's 95%. There are going to be a few people, possibly because they're elderly, possibly because they have other immune responses going on, for whom the vaccine is not as effective, maybe 1 out of 20 individuals or 1 out of 10 individuals. So what does that mean? What the science is telling us is that if everybody gets the vaccine, then even the people who are in the 5% who don't have a great immune response, they can go out because the rates of COVID are going to be so low, so that they're protected by the community. So the science is telling us exactly what people who say, we should do this for the community, for the good of the community. The science is telling us exactly that. And not only is it good for the community, but it's good for us. For instance, I had my vaccine back in February.
Mm-hmm.
I'm probably completely immune, but who knows? So I want to know that when I go out to a restaurant, bar, go on vacation, etc., meet with family, I want to know that other people have been vaccinated, and that protects me, not just the community.
Keith?
Yeah, one other thing I wanted to jump in on that too is and it may not necessarily be a fault of the study, but it's just a observation. When they did the original studies looking at effectiveness of this vaccine, my understanding is that they only tested people who were symptomatic. So in other words, if you got a vaccine and say you were totally asymptomatic the whole time, they never really tested you to see if you contracted COVID-19. They were just asymptomatic carriers. But the people that they were symptomatic, they tested. Mm-hmm. So the question really became is, although we know effectiveness of the vaccine, and we know that it says it's 100% effective in making sure you didn't die from the infection, and 100% for hospitalization for severe disease, the question was whether or not you could be an asymptomatic carrier and then subsequently give it to somebody else. Now, that's all theoretical because they didn't test that part, because they would have to have done COVID testing on everybody who they had in the study, and that was not done. Mm-hmm. So that's why the mask thing is they're still saying you have to wear your mask, is not so much, at least until herd immunity is reached. And that's because you may be an asymptomatic carrier, give it to somebody else who has not been vaccinated, and you would not even know that you were a carrier of the virus.
Okay, our phone lines are lit up, but I do want to say one thing. Last week when I was on vacation, my husband and I was sitting outside by the water, and a couple walked up and engaged in conversation with us. Luckily, they were 6 feet apart, and we were masked, even though we're both fully vaccinated. But the woman that was speaking with us was adamant about not getting the vaccine, and that she had been on the plane and they flew from Chicago to Charleston and there was no way she was going to get vaccinated. And while I did not physically move, I could feel the anxiety in myself just rising. Rebecca, I wonder, how do we convince people that this is so important to get this vaccine?
Well, we need to first understand what are the main reasons, because sometimes people doesn't know. So provide information will be the simple way to pass that information. There is other group of people that feel afraid because the government may be linked to immigration issues. So I better don't go for a vaccine. For other people in different groups here in Northern Virginia and D.C., there is misinformation that comes to them. So people have the wrong understanding that the vaccine costs $120, so I don't have the money. It's another reason. But there are some groups that they may have either faith-based beliefs or political beliefs. So the main way to try to talk to people is first to understand why you don't want to use this vaccine. And for other people, it's a side effect. Oh, it might hurt my arm, I may have fever or something like that. So for each person, we need to have a different type of messaging. So we clarify whatever we can. And when we get to the point of being a political issue, probably we cannot do it. It needs to be somebody from that particular group and a speaker from that particular group of political or faith-based who need to tell their own group and their own community about the vaccines. But we know that there is always a percentage of the population that is not going to get vaccinated. Definitely, they don't want to be vaccinated for anything. Mm-hmm. And probably we don't need to be that much concerned, because if the rest of us are vaccinated, we really can reach the immunity that we need for the community, which is called the herd immunity.
Okay. Our phone lines are lit up, so let's go to the phone. Elena joins us from Norfolk. Hi, Elena. You're on the air.
Hi, thank you so much for taking my call. This is a wonderful topic today.
Thank you.
I want to try to encourage professionals to help people understand when they hear or use the term novel virus, it means that humanity hasn't really confronted a pathogen that behaves in these ways that are so devastating, with characteristics that are pretty perverse. And I mean, one, that the virus presents asymptomatically during infection, transmission, and even as the disease runs its course. And the other is aerosolizing of the virus, not the droplets that people understand, but that it behaves as smoke would in a room or in a space, except you cannot see or smell it. I think if people understood those particular characteristics a little better, things might make a little more sense to them, because I still hear people speak of it as if it were a cold or the flu, and reject vaccines or any of that because they say, I eat well, I juice, I exercise, I don't need to follow these rules, and I definitely don't want a vaccine. I've been vaccinated, I've had both mine, and I'm waiting now for my 2-week period to pass. But I think if people heard that a little more, even though it's frightening, it may be helpful.
Okay.
Thank you.
Elena, thank you so much for the call. Dan, I want to ask you, what's new, or what are we continuing to learn about the virus, since you're a virologist?
Well, there are a number of new things about this particular virus. I should first say that this is not the first or only coronavirus that's been around. There are 5 or 6 others. People will recall the SARS-1 virus back from 2003. There's the MERS virus from the Middle East later on. And then there are 3 literally common cold coronaviruses that have been circulating for a long time that don't even necessitate you going to the doctor, let alone a hospital. These are all coronaviruses. This coronavirus, which came from the wild initially, is very genetically similar to the other coronaviruses, but it picked up new genetic features that allows it to, first of all, infect humans very efficiently, and number 2, it's a very destructive virus, so it goes for the upper respiratory system, the lung, and then other organs, the heart, other organs, and causes inflammation of the vessels, inflammation in the lung. So the syndrome for this virus is altogether different than the previous coronaviruses. And trying to understand exactly what those differences are and how they affect different people differently is like job one for the virologist.
So if there are all the variants that they talk about, are the current vaccines that we have effective against each of these variants that keep happening? 1, and 2, does this mean that every year, just like we get a flu shot, Dan, we will have to get a COVID shot too?
We might. That's going to depend on how long-lasting the immunity is. And, immunity doesn't last forever. It wanes. And it depends on the kind of immunity. So this may last a year. It may last 2. There are some vaccines that last an entire lifetime. We have to wait to see how long it's going to last.
Okay. All right. Let's go back to the phone lines. Laurel joins us from Yorktown. Hi, Laurel. You're on the air.
Hey, thank you so much for taking my call.
Sure.
So I have a really hard time trusting anything new medications, new vaccines, and things like that. I every time I think about thalidomide and how it was supposed to be this miracle drug and it jacked up all those poor little babies. So, but I also want to protect my friends and family and my community. So what sort of advice or information would you give someone to build their confidence in getting the vaccine?
Okay, thanks for that call, and we'll have an answer from each of our experts on that one. Rebecca, let's start with you.
Well, what happened is that I understand the point. I mean, many times new medication, we need to take this off the market after some time of use because we learn different things that made them more present than we were trying to help them. On the other hand, we need to start looking at these vaccines that we have. We're almost 6 months using the vaccine. So looking into the number of people, we have vaccinated so far 70-some million of people in the U.S., more globally. We have had like 1 or 2 maybe cases with reactions or the person who died from the vaccine. On the other hand, we have more than 500,000 people dead with COVID. So if you start looking into these numbers, 1 here, 500,000 here, I think it's worthwhile to look into that and see that the possibilities of getting infected are way higher than the possibilities of having a side effect of bad reaction with the vaccine, quote unquote, we are calling new because they are already being used almost for 6 months.
Okay. If you're just joining us, we're answering your questions about the COVID vaccine. My guests include Dr. Daniel Engel, a virologist and professor at the Department of Microbiology, Immunology, and Cancer Biology at the University of Virginia School of Medicine, Dr. Rebecca Vargas-Jackson with the Virginia Department of Emergency Management COVID-19 Health Equity Group, and cardiologist Dr. Keith Newby, who provides COVID vaccines and is a member of the City of Norfolk's COVID Advisory Board, and of which I am also a member. Keith, tell Laurel why she should trust and take the vaccine.
Okay, I think the first thing is a comparison of outcomes of those who've been vaccinated versus those who get COVID-19 and all the aftermath of what happens with that. If you look at the data of the studies, it talks about safety and efficacy of the vaccine. But I would always encourage her to talk over with people who've been vaccinated. I've been vaccinated. My wife's been, my mom, who's 91, her sister is 93. Both vaccines have been given. My brother, my sister, aunt, uncles, cousins, patients. We've done over 2,000 people here in the office and have had no real issues at all. When you look at just the comparison of those who have been infected with COVID-19, and I'm running to more and more people who've had COVID and are having these, they're like what they call them long haulers, where they've having other aspects of the virus that are longer lasting. I had a lady yesterday I saw who had it back in December, and she said she still can't taste or smell anything. And this is 5 months later almost. So when you look at just the comparison between the two, and you look at the data that's out there currently on the vaccines and its safety, I think that will help you. And then talking to people who've been vaccinated, I would always encourage people to do that. That's why I say every time I do any talks or discussions, I always say I've been vaccinated. So I do all that for that reason. So I think if you talk to other people who've been vaccinated, look at the data, you'll see the safety of this vaccine, and that may guide you. And think about, if you don't take the vaccine and then you get it and infect somebody else, what will happen to that individual? So look at how what you do is going to impact on other people.
Okay. Dan, you want to add anything?
Yeah, sure. I appreciate these answers and also the caller's question, because she mentioned that the vaccine is new, and you're right, it is new. Now, it has gone into over 100 million arms, so in that sense, it's not really new anymore. But look at it this way. There's another thing out there that's new, and that's the coronavirus. So we've got two new things going on, and we have to decide where's the riskier choice.
Okay.
And the data clearly indicates that getting the vaccine is much, much less risky than dealing with this new coronavirus.
Okay, Laurel, I hope that helped you. Let's go to Daryl in Norfolk. Hi, Daryl. You're on the air.
Hi, how are you?
I'm great.
Thank you for having me on. First of all, I'd like to briefly say hello to Dr. Newby. For years, I served him lunch over at the medical tower. But what I wanted to say was, it seems to me that people are really freaking out about the Johnson & Johnson drug shot, and that women are experiencing blood clots. But the fact is, only 1 in 1 million women, or 6 in 7 million doses that have been given out so far, have resulted in blood clots in women, and those women had low platelet counts. Now, the chances of a woman developing a blood clot from birth control pills are 1 in 1,000. And yet, the results that you will experience if you get COVID are just so devastating and can last a lifetime. They can either kill you or last a lifetime. You'll have a lifetime. You could, of course, we don't know for sure, but you could end up with a lifetime of residual effects. And I know that some people say it's a false equivalency, but I think that it's valid. I think that when you say it's 1 in a million, compared to something women do every day without batting an eyelash, and that's taking birth control pills, that you have to think about that. What are your risks? What's your risk?
Are you vaccinated, Daryl?
Yes, I am. I'm fully vaccinated, as is my husband, as is both of my children, all 3 of my children, who are all in their, two in their 30s, and one is 53. But yeah, and my whole family, my sisters, we're all vaccinated.
Fantastic.
And my daughter is 37. And I just haven't heard anywhere that argument at all. That okay, do you take birth control pills?
Got you. Okay. Thank you, Daryl, for the call. We appreciate that. So you guys have really addressed a lot of what Daryl was talking about in terms of the small number of people, and that it is an abundance of caution, that you pause, you take a look at what's going on with the Johnson & Johnson vaccine, and then continue. Let's talk about access for a minute. Rebecca, I know you work with minority communities, and Keith, you do in particular, but there seem to be different ways that we need to reach people in order to get them the vaccine. Why is that? Why can't we just do a normal, everybody come, take your shot? Why do we have to do different ways in order to reach different people? Let me start with you, Rebecca.
So at the beginning of this pandemic event, we were reaching people through the, websites and so forth, and the people needed to register into the website to be able to receive a vaccine. But as we know, there is a large number of the population that has no access to a laptop, to a smartphone, et cetera, So needed to be different ways for people to register to be vaccinated. In addition to that, the messaging that we were sending needed to be developed in a cultural appropriate manner. Meaning, if you're doing something for senior citizens, probably a large font and with a telephone number was more helpful than if you're sending the message for some university students that they can read easily in their laptops or computers. And then we have the language barrier. So we start putting everything into Spanish initially, and then now in the 5 most common languages that we have in Virginia. But these are the issues that sometimes are limiting people from understanding what is the next step or what they need to do. But if we're talking about access, another huge issue was with transportation, because at the beginning, the sites in which we were vaccinated were not accessible with public transportation, at least in Northern Virginia and in many other areas. They had no ways of transporting and no way that we could take a bus and put all these people in a bus, because what about if one of them was infected? We were infecting the whole group. So these particular gaps that we found in the system, we have received lots of help in the government to now build a system that is really well equipped to deal with. I'm going to hang up that.
Okay.
Really, the needs of different groups in the community, because we know that there are different particular groups that they have different needs, in addition to people who is in nursing homes, which I think we addressed very well at the beginning. Of this vaccination.
And Keith, the same question to you. Why do we have to do it differently for different groups?
Well, I think most of it was probably already stated, but I think a lot of it is how people perceive the vaccine and who's delivering the message. You know, you got, and it depends on what category you're in. I think if you look at the three categories, I look at those who are going to get the vaccine no matter what, those who are on the fence, and those who say, no, I don't care what you tell me, I'm not going to take it. If you're in the first category, then you could do what you said initially. You could just have a clinic. You say, "Go ahead, come on, get your shot," and they will come get it. But when you're on that fence, and that's the group that I've been working on mostly, that's the group that it depends on who's delivering the message, you know, and that's going to dictate how easily they are willing to potentially accept it. So that's what I've been pushing on my end. That's why I think having people like myself, faith-based leaders, other leaders in the community, and just people in general who can help to belabor some of those concerns. So until we get to that group, I think you're going to have different venues that people will have access to be able to make the best decision for themselves.
And Dan, go ahead.
Yes, I agree. And to keep in mind that the scientific studies clearly show that access is a huge problem. Yeah. It's something that we have to overcome as a society to work on these things and to speak to people maybe in different ways in order to reach them. But access is keeping us from getting to herd immunity as quickly as we would like.
As we need to. 440-2665 or 1-800-940-2240 are the numbers to call. Give us a call. Let us know what your questions are about the COVID vaccine. Dan, speaking about access, you have a group that is doing some work where you will talk with them about and answer any of their questions. I believe it's the Virologist Association. And I want to play a clip before I get you to tell us how to reach them. Let's play a clip. This is the one where they're talking about, you don't have it? Okay, I'm sorry. But Dan, there's a website that people can go to and they can register to have questions answered.
The American Society for Virology has set up a website, and the address is ASV, which is American Society for Virology, asv.org/education.
Okay.
And if you go there, you can register for a town hall. It's a virtual live town hall. There's one that happens almost every day. We have about 60 virologists and infectious disease experts, medical doctors, who take turns hosting these town halls. They're from across the country, and we're there to answer questions. And you can ask any question that you want. The most important thing that we do is we listen. We listen to the questions, and we try to understand where the questions are coming from, and then get to the bottom of what the answers are. We're not trying to convince anybody of anything. We just want to know what are your questions, and we will bring a scientific approach to the answers.
Okay, we have that clip now. Let's play that.
Do you have questions about the COVID vaccine?
Talk to me.
Talk to me.
Talk to me.
I'm a physician and a scientist.
Yo soy virólogo.
I'm a doctor.
It's totally okay to have questions.
It feels better when you have answers.
Sign up to Talk to Me.
Talk to me. Pregúntame.
And you can sign up to talk to me too.
Get answers to your questions.
To your questions.
To your questions about the COVID vaccine.
And that's the American Society of Virologists. Did I say that right? Okay. And it's AS as in Sam, V as in Victor.org/education. So there's yet another source for you to go to. Let's go back to our phone lines. Chris joins us from Norfolk. Hi, Chris. You're on the air.
Hi. Thanks for having me. I just had a question sort of as the rollout continues and as access challenges are sort of met. At what point do workplaces and schools have the ability to step in and start requiring vaccines in order to come back into public life?
Rebecca, you want to take that one? Do you know?
Sure. There are some universities that already require for students that they are going to be on campus to get vaccinated, which kind of makes sense because just, campuses, people live in very close environments. And I think it's going to be the decision of each locality because different groups may have a different idea of what is going to help the most to the communities. But once we start vaccinated children, probably it's going to be easier to start seeing people going back to work. And as I mentioned, if we don't violate any regulations, most likely people is going to be either required somehow to do it or continue working from home via computers or something like that. Mm-hmm. But I think it's a very interesting question because when we started with that some months ago with a university in New Jersey, it was news. And now we know that there are many other campuses doing the same thing.
Mm-hmm. I know that there are private businesses and others, too, that are grappling with can we require all of our employees to have the vaccine? Legally, is that something that can be done and so forth? I don't know if Dan or Keith, if you have anything addition you want to add to that.
Well, what I've heard is that the businesses can require it, but my understanding is the legality of it is that if somebody says they have a religious belief that they can't accept it or there's some other medical condition they have, then you can't make them get it. But that was my understanding, that you can require it legally. Okay. But there are some limitations to that.
Dan, anything you want to add?
Well, I had a nice conversation with an Army colonel who told me and who works on this particular issue. Mm-hmm. And he's in Bethesda, Maryland. And he told me that right now the military is not requiring the vaccine, but that they may get to a point where they will compel people to become vaccinated, particularly after there's full approval. So I think we're moving to a place where more and more entities are going to be requiring this.
Okay, let's go back to the phone line. Liz joins us from Newport News. Hi, Liz. You're on the air.
Hi, good afternoon. Thank you for taking my call. As someone who is recently ready to take the vaccine, I haven't really been paying attention to where it is I sign up or how I sign up and how I sign up and actually be successful in getting an appointment and getting it done quickly. I'm
glad you asked that question. First of all, there are two things. There's a couple ways you can go. First, you can go online to vaccinate.virginia.gov, or you can call 1-877-VAX-IN-VA. So, and I don't, you know what? I need to figure out what that actual number is, but I will pull that up for you. The other thing is that there are places such as Military Circle Mall in the city of Norfolk that is a super site, if you will, where you can go and actually register on site. And you can sign up there. If there are vaccines available on that day that you sign up, there's a possibility you could get your shot that same day at that same time that you register. If not, they will give you an appointment, and you can go from there. And Rebecca, you want to add some things to that? Mm-hmm.
Sure. The phone number is 1-877-829-4682.
4682. Okay.
Exactly. And it's very easy and friendly to the user. We are there from 8 a.m. to 8 p.m., 7 days a week. So Saturdays or Sundays, please give us a call.
Okay, that number again, so that you have it, Liz, is 1-877-829-4682. Okay, let's go to Greg. Joins us from Virginia Beach. Hi, Greg. You're in the air.
Great conversation.
Thank you.
Yeah, I was wondering, I think you guys might have touched on it, but I'm concerned about the HIPAA laws. Well, I should ask them this way. Do HIPAA laws prevent employers from asking employees anything medical?
That is a very good question. I will tell you, just from my experience here at WHRO, as they tried to figure out how we're going to let people back into the building en masse, and we were asked if we got the vaccine, but we were not asked if you took it or why you didn't if you decided not to. So they did ask the question, have you been vaccinated, but did not ask for any specifics about if you have not or if you choose not to, why that is happening. Does anyone know, Rebecca, do you know from a legal perspective, do the HIPAA laws protect against asking anything?
Actually, we have privacy laws, but we need to take into consideration that throughout this pandemic event, we haven't being able to follow many things that would have been done before, because the idea now is that people is dying. And so they can make many exceptions to existing rules and regulations, obviously to some limitation. And I know that for universities, at least, if there are religious issues or health issues that prevent students from getting vaccinated, they are not going to be penalized for that. They just need to prove that that is happening. One way or the other. So I believe that somehow we have been listening in the news that even the airlines were talking about the passport that says that you have been vaccinated. But that has been in existence for many, many, many years. I have been working in African countries, and then you have to have your vaccination card with you before going to work in many African countries or forever. So it wouldn't be any new thing, probably new system only.
Mm-hmm. You know, I think that a lot of it also, Greg, it as happens with technology and with other things, that the law takes a while to catch up with the reality of what's happening in the country. So I'm sorry we don't have anyone who's legal here, but Dan, you want to respond?
Well, the HIPAA, I'm not a lawyer, of course, but the HIPAA law tries to balance the privacy issue with the public health issue. So what's best for the whole public health? And so it's not an absolute privacy law, and I don't think these things have been decided yet, Greg, but there is room for this situation to evolve.
Mm-hmm. Also, if you are interested and you are in the general Hampton Roads area, although you can be from anywhere in the state of Virginia for that matter, the Virginia Beach Convention Center is taking walk-ins today until 3 p.m. So you can go to the Virginia Beach Convention Center, walk in, register, and get your shot. So there are many, many ways to try to make sure that the shots have access. Let's see. Do we have another phone line that we can go to? Let's go to Michael in Norfolk. Hi, Michael. You're on the air.
Hi. Thank you for the discussion, Barbara. Mm-hmm. Barbara, a number of virologists, very prominent, have been appearing on major networks and talking about this virus 2019 as a novel virus, and they say that it bears the characteristics of a virus created by gain-of-function research, which in essence would say it is a weaponized virus, and that may be the reason why 40% of the Marine Corps refuses to take any of these experimental vaccines. That's what they are. They're not vaccines. They're experimental vaccines.
All right, Michael, we've got about 3 minutes left in the show. I want to give Dan a chance to answer your question, okay? Thanks for the call. Yeah. Dan, you want to respond to that?
Thank you for the question, Michael. And I can tell that you feel about this very strongly, and I understand that. And the way to address this question is to ask the question, okay, how are we going to find out whether this was a created virus or not, whether it was a gain-of-function test? And the answer is that the experts in that field went back and they determined the sequence of this new virus and compared it to where it came from in the wild. And that was the only explanation. It could not possibly have come from the laboratory, a synthetic laboratory, because all of those viruses have been sequenced, and they are extremely genetically different from this virus.
Okay. Thank you, Dan. I appreciate that. So we have 2 minutes left. I want to give each of you an opportunity to say something to the audience that you would like to encourage them to take the vaccine. Let's start with you, Dr. Rebecca Vargas-Jackson.
I think the most important issue that the community needs to remember is that social media sends misleading information as much as very scientific facts. So you need to start looking for who is sending that message. If it's CDC, if it's NIH, if it's your health department, most likely there are scientific facts, and base your decisions on scientific facts. And whatever is coming as pieces of misinformation, probably you don't need to pay much attention. We don't know the reasons, and there will most likely be not good reasons for trying to discourage black and brown communities from getting vaccinated.
Okay.
So pay attention to facts.
Pay attention to the facts. That's Dr. Rebecca Vargas-Jackson. Thank you so much, Dan. You got 30 seconds.
Okay, if I were sitting with someone and they were hesitant, I would say that the vaccine is the closest thing to a natural remedy that we have. The vaccine causes your own body to make the preventative molecules that are going to stop the virus. The vaccine is not a drug. It is as close to a natural remedy as we possibly can have.
Okay, thank you, Dan. That's Dr. Daniel Engel, a virologist and professor at University of Virginia School of Medicine. Keith, you got the last 30 seconds.
Okay, so the first thing I would say is, please, everybody, stop trying to, no conspiracy theories on this stuff. Stop politicizing this. This is not that area where you want to do that. Think about what you do, how it affects others. When people keep saying, I have my rights to do A, B, C, D, and E, I'm like, I have my right to live as well. And if you refuse to take something and then you affect someone else, be it your family, loved ones, whomever, coworkers, think about what you do and how it affects other people. Take yourself out of self and look at the rest of the world, and maybe you will see why this is important.
Okay.
So everybody, from my perspective, please go get that vaccine.
All right. Thank you. That's Dr. Keith Newby. You guys know him. He's always here on the show with us, and he always keeps it real. Thanks so much. Now, we've shared a lot of information today, and I hope that you will absorb what you've learned. And if you're hesitant about the shot, that we have allayed some of your concerns. By the way, the Military Circle site today is taking walk-ins. There are no lines currently. It takes about 20 minutes, and they're open nightly until 6:45. So you can go there, register, and move on. Please share this program with your friends and loved ones. You can find the podcast at our website, anotherviewradio.org. Please do your part to prevent the continued spread of coronavirus. Register and get your shot. Continue to wear your mask in public. Stay 6 feet apart and wash your hands frequently. Our theme music is an original composition, especially for Another View by Jade Sennett. Lisa Godley is our show producer. Todd Washburn is our audio engineer, and Dr. Barry Graham answered our phones. You're hearing the happy birthday song because that's for Lisa Godley, whose birthday is tomorrow. Happy birthday, Lisa. I'm Barbara Hamley. Thank you so much for joining us, and let's get together again next Thursday at noon for Another View.
Support comes from Hampton Roads Community Foundation, partnering with donors from all walks of life to improve southeastern Virginia through grants, scholarships, and leadership initiatives. Learn more at hamptonroadscf.org.